Hi everyone, welcome to researchmd.com. We got another great topic today. We're going to teach you everything about acne. Again, my name is Pramil Cheriyath. I'm a program director in internal medicine residency, translational residency. I'm also director of research, and I teach medical students and residents on a regular basis. So today our topic is like a simple, worldwide, most common problem, acne. Okay. So when you talk about acne, I mean, definition, you can say chronic skin condition commonly arising on the face that is characterized by inflammatory lesion. Could be open or closed comedones. People call it black hairs and white hairs, and without inflammatory lesions, you can have papule, pustule, or nodule. So chronic skin condition affecting the face. Okay. Now, epidemiology, most common in the young adults. Acne affect 85% of all teenagers in some degree. So huge number of people are affected as when you're a teenager. So risk factors, many things can contribute, like polycystic ovary syndrome is like one of the risk factors. You got emotional stress, so occlusion of the skin surface with the greasy product, sweating, and then medication sometimes can associate with exacerbation of acne, like anabolic steroids, bromide, corticosteroid, isoniazid, phenytoin, azathioprine, and cyclosporin. Now, what is the let's look at the pathogenesis of acne formation. First, you got accumulation of keratinocyte, which causes the outlet obstruction of the pilosebaceous unit. And then you got the sebum builds up. Okay, you block the follicle formula and forming a comedone is formed. And non-inflammatory lesion, which can be open, blackhead, or closed like a whitehead. And anaerobic bacterium, Citrobacterium acne, proliferates in this comedone. And inflammation of the comedone results from leakage of sebum into the dermis and secretion of pro-inflammatory mediators can by acnes. Okay. So when you talk about the signs and symptoms, you got face, neck, back, chest, upper arm. So for comedones and inflammatory lesions, and then not only face, remember, you can neck and the back and the chest, and the comedones are formed when hair follicles become plugged with the keratin or sebum. Both open because of a blackhead and a closed whitehead. Comedones are common, and inflammatory lesions of acne may appear as papules, pustules, and nodules and cysts. And the papules, when you talk about the raised erythematic, could be pink or red, 2 to 5 millimeter in diameter. When you talk about pustule, they're superficial papules with a visible core of purulent material, remember that. And then nodules, and you have solid and raised inflammatory lesion greater than 5 millimeter in diameter, that may be tender with the palpation. Now let's look at some pictures. You got signs and symptoms. You got severe inflammatory papulopustular acne, very obvious form. You got the papules and pustule like less than 5 millimeter, large open comedones, significant post-inflammatory erythema, and a few atrophic scars and all that skin. And then you got severe nodular acne, very obvious nodules like greater than 5 millimeter on the forehead, chin, and the post-inflammatory erythema and like a few atrophic scars also be seen. A diagnosis mainly of the clinical and your dermatology examination based on the skin exam, you should be able to diagnose it, right? And then how do you classify acne? You can say mild acne, moderate acne, severe acne, right? Mild is like scattered. There's few comedone or inflammatory lesions, less than 20 comedones or less than